There is one symptom of hiatal hernia that gets misdiagnosed almost every single time. And I'm going to share what that is with you before this video is over. Hi, and welcome to my podcast, Gut Health Nurse. I'm your host, Kamisha, and I've been a registered nurse for over 10 years. During the course of my career, I developed digestive issues as well. I had my own bouts of struggle with hiatal hernia, gastritis, bloating, GERD, acid reflux, um, you name it, right? I've had my fair share of issues, so to speak, with these digestive issues. And that is one of the reasons I wanted to bring this to you so that you can gain clarity and understanding, gain some perspective as to what you may potentially be going through. What are some of the things that I did to have relief, to feel better long term? Right. So, welcome to my podcast. This is episode 1 of Gut Health Nurse podcast. And so, thank you for joining me. And let's dive in. Today, we're going to be talking about what a hiatal hernia is. We're also going to be talking about the two types of hiatal hernia and which one you would need more attention, or you would need to be more proactive with if you were to have that one. We're also going to be talking about the exact mechanism behind the symptoms that are associated with hiatal hernia. We're also going to be talking about what causes it, how it's diagnosed, and what you can actually do about it. And again, I'm going to be sharing with you the symptom that is most commonly misdiagnosed, and you're going to want to stick around to hear that. So let's dive in. So I have seen as a nurse countless times that patients have been to their provider's office and they leave with more questions than answers. And unfortunately, this was the case for me too. When I was first diagnosed with hiatal hernia, I had way more questions than was answers that were provided. And even when I did the endoscopy and it was found or verified that that's what I had, I still had more questions, right? And I'll share more about that later on. So you're not alone if you've been newly diagnosed or if this is something that's been a concern for you and you have many questions, right? So first, let's go into it. What is a hernia to begin with? So with a hernia, you have parts of your stomach or organs that's passing through openings that it's not supposed to go through, right? So you have, like, for example, an umbilical hernia where parts of your intestines, parts of your gut passes through the abdominal wall, and that creates an umbilical hernia. Well, that's not supposed to happen, right? And so it's the same thing for a hiatal hernia, just same concept, essentially, just a different location. Specifically with the hiatal hernia is when parts of your stomach pushes up through the opening in your diaphragm, and that opening is called the hiatus, and that goes into the chest cavity, and that's what creates that or causes what's known as a hiatal hernia. So the diaphragm is a large dome-shaped muscle sitting below your lungs, and it separates the chest from the abdomen. The hiatus, again, is a natural opening in the diaphragm, and it allows for the esophagus to pass through it and connects to the stomach. So what's normal is for the stomach to sit below the diaphragm. That's normal, right? That's where it belongs. So the stomach sitting below the diaphragm, that's normal. With a hiatal hernia, again, parts of the stomach slides up through the hiatus. That's not normal. This disrupts the lower esophageal sphincter. The lower esophageal sphincter is a valve between the esophagus and the stomach. So when you have the parts of the stomach pushing up into the diaphragm, that pushes things out of place and cause a lot of disruption, including affecting the lower esophageal sphincter, which its job is to keep the stomach acid down where it belongs. So the lower esophageal sphincter is like a gate that keeps things out and allows certain things in at specific times. So that creates a lot of issue when that happens with the hiatal hernia. And that's where we get a lot of symptoms from. When you have things happening out of order, essentially, that creates disruption and cause unpleasant symptoms. Now, if you've been following my other postings on my YouTube page, you know that I firmly believe that symptoms are like warning signs, right? They tell us when we're doing things or when things are occurring that's not naturally supposed to happen. And so they're like flags, warning signs to say, hey, you're doing something that's out of order. You're doing something that's not in alignment with how your body should naturally function. And so we're telling you that you need to slow down, course correct, change direction, like do something. Don't continue what you've been doing because it's going to create issues for you. You're not going to have pleasant symptoms. You're not going to have pleasant experience, right? So course correct. So same thing with having a hiatal hernia. When there is disruption in natural order, you have what's these symptoms that shows up to say you're doing something or something is being done to the body that's pushing things out of its natural way of functioning. Fix it, or you can just live with the symptoms and just know that that's what's causing it, right? So the lower esophageal sphincter again is like a gate. So it's everything. It's like your protection for your home, right? Your home security system, if you will. Every symptoms connects back to it, because this valve, if when this valve is compromised, it's not able to keep things out like acid that should be kept out. And so you have things just free flowing in an abnormal way. So now we're going to be looking at the two types of hiatal hernia. The first one is sliding hernia, and this occurs in about 95% of all cases. This is probably what most of you who are watching have. I also had a sliding hernia as well. So in this, the gastroesophageal junction is basically where things occur, right? So you have the esophagus meeting the stomach, and the stomach slides up through the hiatus at that junction. So it moves up and down. And there are different things that throughout the day may cause for that movement to occur, whether you're eating, bending over, or laying down, then it may slide up, right? And then you do something else and it slides back down. So this is why you have that inconsistency in the symptoms that you're feeling, because it changes from day to day, and this is very frustrating and can make you quite miserable indeed, because your hernia is literally moving, sliding as the name suggests. So for this mechanism and how things are moving, there's a strong association between how things are functioning and GERD, because of the lower esophageal function and how it gets pushed out of place, right? So again, for most people who are watching, it can be very frustrating if this is what you have, because one minute you have it and the next minute you're wondering if you really have it, because you're no longer experiencing the symptoms. And just to be clear, not everyone who has a sliding hernia has symptoms. Some people are, as they call it, asymptomatic, right? But it doesn't mean that you could not potentially have the side effects. It just means that you're not having it at this particular time if this were to happen in your case, right? So we're going to be talking about again the different mechanism of how it happens and the different things that you can do to help with that. Diet is a big part of our living, our well-being, and in some cases it can impact this, but it's not the only thing to consider if you're diagnosed with this. All right. The second hernia we're going to be talking about is paraesophageal hernia, and this occurs in about 5% of all cases. And for this, parts of the stomach, sometimes other organs, pushes up alongside the esophagus and it stays stuck. like literally stuck. It does not slide back down. It's less common, but it is more serious than a sliding hernia because it can cause severe chest pain, difficulty swallowing, feelings of being full very quickly. But more than that, it can also cause what's called incarceration. And that's where your stomach that is stuck starts losing blood supply. And that is not very good in any area, right? When you start losing blood supply, because you could potentially cause that area to start dying, is what that means, right? So definitely not a case of something or a position that you want to be in to where you have any organs or parts of your body stuck. That in itself requires medical attention. So large paraesophageal hernias typically are referred for surgical intervention or evaluation. Let's say that. If you've been diagnosed with sliding hernia, which most of you are, and which again, I was diagnosed with that, surgery is usually not the first answer, right? Lifestyle management typically works well for taking care of this. And this is what we'll be covering in this series: lifestyle management and things that you can do to better or to manage yourself in such a way that you're not constantly experiencing the discomforts that may be associated with this. And like I typically usually say on this channel or on my channel, symptoms are signals, they're warning signs. They tell us, hey, you're doing something to the body that is not the most optimal for you to be doing. And so this is your warning sign that you need to course correct, you need to change your action, you need to do something different in order not to have this discomfort, right? So it is not a matter of your body beating up on you. It's your body saying, hey, I need a little help here. Do something different to help me out, right? So we're going to now move on to why you have symptoms, talk about the mechanism in general that may lead to you having certain symptoms. Now, there are three things that go wrong with the LES. And the LES, again, is the lower esophageal sphincter. And in this, you can have loss of diaphragmatic support. So the diaphragm normally helps to strengthen the LES, but when the stomach herniates or pushes up, you lose that mechanical support and the valve is weakened. So the structure of everything is positioned in such a way that each one helps one, right? But when things are out of order, when things are out of sort, then it leaves something lacking and needing a bit of extra help. And in this case, it's a lower esophageal sphincter. If the support of the diaphragm is not there because the diaphragm itself is now being compromised, because something that should not be pushed up through it is pushed up way more than how things are designed to go. The diaphragm is designed to have the esophagus pass through it, but only the esophagus, not the esophagus and the rest of the stomach or the stomach contents, right? So that in itself is something that changes how the diaphragm functions. And so that loss of diaphragmatic support can also affect the lower esophageal sphincter in how it itself functions. The other thing is acid pockets. So when the stomach is above the diaphragm, a small reservoir sits right at the junction. So again, imagine you having a balloon that is filled with water and you squeeze the bottom of the balloon while holding midway through the balloon, right? It bulges up at the top. So same thing or similar thing happened with your stomach when it pushes its way up through the hiatus where it's not supposed to go. It creates a small pocket of acid in that upper portion of the stomach that passes through the hiatus. So with every swallow, the acid is primed to go up into the esophagus, right? And goes up in that area, which is that's not supposed to happen. And with the lower esophageal sphincter not functioning like it should because it's pushed out of place, then it's not able to close like it's supposed to and keep the acid down in the stomach. The other factor has to do with pressure. Anything or a lot of things can increase abdominal pressure and push the stomach through the hiatus and forces acid to pass the weakened valve. So the valve can't function because it's pushed out of place or compromised in a sense. And then you have all these abdominal pressure or different things that's happening in your abdominal region that's creating pressure that is further adding to the issue, right? So what are some of these things again that causes pressure to increase in the abdominal region? Bending over, wearing tight clothes, constipation and straining, large meals, so having your stomach filled to capacity, lying down shortly after eating without allowing for proper digestion, pregnancy, and heavy lifting. So, whether you're lifting up a person or you're lifting weights or other objects, if you're lifting heavy, that creates internal pressure in your abdominal region and that pushes more of your stomach into the chest cavity where it shouldn't be if it's already going up there. So those are some of the things again that can increase the pressure in that area. So now we're going to go through them symptom by symptom and see how each one of them occur. Let's look at heartburn and acid reflux. The stomach acid touches the lining of the esophagus when you're having heartburn and reflux, right? Because things again are going, acid that should be in your stomach is flowing upwards where it shouldn't go. So with that, you have that heartburn and you have acid reflux. Now, unlike the stomach, the esophagus does not have a protective mucus coating to prevent the acid from eating away at it or from touching it. So that burning is acid on your unprotected tissue in the esophagus region, right? The next symptom that can occur from this is chest pain. It's a very common misdiagnosis. You have the esophagus and the heart sharing a nerve pathway. The esophageal pain can feel exactly like cardiac pain. This is why, for a lot of people who have digestive issues, they're typically referred to a cardiologist. That's because the esophagus and the heart, they're sharing a pathway. Then there's that lump in the throat feeling, right? Or globus sensation, as it's called. And that's where the acid or reflux is reaching the upper esophagus and the throat. So in this, you have inflammation that creates that persistent stuck or lump feeling. It's not a lump. It's tissue responding to the acid that is reaching it. The other symptom that's experienced or that can sometimes be experienced is that of having shortness of breath. A large hernia can physically compress the lung space slightly, and you have a vagus nerve that is there and it gets irritated, and that can also affect your breathing pattern. Then you have heart palpitation. And this is one of the reasons why, again, a lot of people get referred to see a cardiologist because heart palpitation can be a symptom of having hiatal hernia. So, in having a heart palpitation, what's involved is that the esophagus and the vagus nerve are anatomically very close. So, the way they're positioned, they're like buddy buddy pal pals, right? And so the acid that's touching the esophagus triggers a vagal response, right? And when a vagal response is triggered, you have changes in heart rate, and that leads to palpitation. And many patients are therefore sent to see a cardiologist and put on anxiety medication and told that it is stress. So, this is a symptom I promised you at the beginning, right? Heart palpitation. A lot of times, for individuals who have hiatal hernia that has not yet been diagnosed, or it's been diagnosed, but um, heart palpitations are occurring and the connection is not made between the two. A lot of patients can be misdiagnosed with just simply having anxiety, right? Because you do the cardiac workup and it shows nothing. And so the next step is, perhaps it's your state of well-being that is otherwise compromised and leading to you having triggered your body into having these cardiac events, right? And so you may be diagnosed of having anxiety and you're put on medications and the medications don't help because you weren't necessarily having anxiety related symptoms, right? The symptoms you were having were not stemming from anxiety, it was stemming from a mechanical defect that resulted as a result of the hiatal hernia that you have. So if this happened to you, you're not alone. I know that was a mouthful, but if this happened to you where you have digestive issues and you're diagnosed as having anxiety, when you're taking the anxiety meds and you're still having other issues, you're not alone. You're not alone in this at all. And so, again, this is one of the reasons why I created this podcast to shed some light and perspective so you may have some clarity and have a bit more understanding when you're talking with your provider, and you can better understand or be able to communicate with them potentially what you think is going on and be an advocate for yourself. So for a lot of times, again, unfortunately, that's the case. And in all cases, it's better to be safe than sorry, right? So if you're having a heart palpitation, for sure you want to make sure that you're not having a heart attack, right? But the next step after clearing that, or after that is being evaluated, perhaps should be a referral to see a gastroenterologist or a specialist in that area to ensure that the symptoms are not indicative of what would be digestive issues. Hi. 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 Now, let me know if the comments, if you've had issues where you've gone um, to see a cardiologist or other providers because of some, unknown factors that were at play, and you were told that you have anxiety and you were put on medication as well. So essentially, being this, your symptoms were dismissed or not caught as it having to do with something relating to your digestive system. That many people also have nausea or symptoms of nausea, especially after eating, because they have disrupted the positioning of the stomach. And this can also lead to having delayed gastric emptying. And then another one that's perhaps not even correlated or typically identify with being digestively related is that of having back pain between the shoulder blades, right? But that too can also be something that is experienced, and it's known as referred pain from the esophageal or diaphragmatic irritation that's occurring. So again, remember your diaphragm it has a space called the hiatus that the esophagus is supposed to pass through. But when you have sliding hernia or other types of hernia, it's pushing through that space that it's not meant to go through. So that in itself causes irritation. And then, of course, when you have the stomach passing through there and you have acid flowing backwards and getting in contact with the esophagus where it's not supposed to, that too can cause irritation. And those different irritation into backflows that are occurring can then lead to sensations of pain or pain flowing from that area and leading it into you having back pains in your shoulder blade. So again, if you're having symptoms and you've been dismissed, it's not in your head. It's just maybe a matter of fact that you were not sent to a specialist who understands the symptoms as you were portraying them, or took it for something else, or whatever the case may be. If this is you, you're not alone in this. All these issues, so far as you can see, there is a mechanical explanation for it. So if this is you, and if you've been told that you have anxiety, you've taken medication, it still hasn't helped, perhaps this is a conversation that you can have with your provider to probe a bit more, to see potentially if further exploration can be done of your digestive system to ensure that this is not a hiatal hernia situation that's going on. One of the most commonly asked questions is, what causes hiatal hernia? And there are many factors that are at play that puts one at risk for developing hiatal hernia. Things like age. So hiatal hernia opening naturally weakens over time. So most people are diagnosed over the age of 50, but by no means is this only a condition that affects people who are older than 50, right? Then there is repeated increase in abdominal pressure. And this is from the cumulative effect of having that repeat pressure over the course of years. Now, what are some of those things that cause repeat exposure to pressure? We have things like chronic coughing, repeated vomiting, heavy lifting, especially when you're a nurse and you're having to move and reposition individuals, or if you're a mom, that too, lifting up kids and different things like that. That can certainly be a factor as well. Straining during bowel movements. So if you have chronic constipation, pregnancy, especially multiple pregnancy, body weight. So if you have excess abdominal weight, this creates chronic intra-abdominal pressure, right? So if you have excess body weight, that can create increased abdominal pressure that stays consistent over time, and that increased pressure can also add to you having hiatal hernia. Prior injuries or surgeries in that area can also weaken the hiatus. Genetics, some people have, or some people are born with larger hiatus, right? That hiatal opening is typically larger for some people. And then there's chronic stress, and this affects the gastrointestinal tract, the smooth muscle tone, and acid production. And all of this too can play a role in one having hiatal hernia. And then there is chronic stress. As we mentioned, chronic stress affects the gastrointestinal tract and the smooth muscles. So chronic stress affects the gastrointestinal tract, the muscle tone, and acid production. Nurses who work long shift, long hours, and in high pressure environment are also predisposed for having that issue, as well as moms, as I mentioned earlier, from having chronic stress, sleep deprivation, and cortisol elevation. And this is something that we'll talk about in future episodes as well. What I want for you to take from this, that it's almost never one thing, right? It's usually a combination of different factors that are at play for this. But the good news is that knowing what the different factors are, you're able to look at your life and see which ones may be contributing to the issue for you, if hiatal hernia is something that has been a challenge for you. So the goal of this is not to blame, right? Not for you to blame yourself, but rather to become more conscious again of the mechanics of the body, and be better able to maneuver different areas of your life that will alleviate the discomfort that comes from this, or the displacement that comes from having hiatal hernia. So as I mentioned previously, I too had issues relating to hiatal hernia, gastritis, acid reflux, GERD, and bloating, and every other symptoms that are typically, or most of the other symptoms that are typically associated with this. So as previously mentioned, I too had issues with hiatal hernia, gastritis, acid reflux, bloating, like just an array of digestive symptoms. And I had my own, I was in that position too, where when I had palpitations, I went to see a cardiologist and everything came back normal. Did the whole cardiac workup, everything came back normal. At different times I was told it's anxiety related. Of course, no medication was proposed for me, but I did do an assessment of my life and made some changes to those areas that I thought would be adding to me having increased anxiety or stress or anything like that. Well, when the issue persisted years after, and I was having persistent abdominal pain, bloating, that feeling as if something is stuck in the throat, and waking up to that sensation in the middle of the night, I finally went and saw a gastroenterologist, and I asked, like, what are the lifestyle changes that I can make to see an improvement in this? I was prescribed a PPI and told to take it, or else I would be back in his office. It was also recommended that I did a stool sample to make sure that I didn't have H. pylori, and then also recommendation for an endoscopy. Well, I did both the stool sample and then I did the endoscopy. Both were negative for H. pylori, but they did find that I had mild gastritis, acid reflux, and hiatal hernia. So again, I asked, what can I do to improve my situation? And the answer was the same, right? So I was left to figure it out on my own. And thankfully, I found an exercise that I was able to include in my regimen to bring the stomach back into its normal place. And so once I did that exercise, within a few days, I had no more feeling of like having that Globus sensation. Reflux was no longer an issue. Like I wasn't waking up to that feeling at night and all that, right? So I followed that through with dietary and lifestyle changes. I had come to the conclusion from my own research that those were huge factors that I needed to pay attention to in order to have lasting results. And so those are the things I included in my regimen on a consistent basis to better manage myself, right? So how is a hiatal hernia diagnosed? As I mentioned, I did an upper endoscopy, and that's where they pass a camera through the esophagus to evaluate how things are, if things are in their proper position, or if things are out of alignment, or what else is going on down there, right? And so this is the most common method for diagnosing hiatal hernia. Then you have the barium swallow, which is contrast liquid that they watch through the gastrointestinal tract on imaging. Then sometimes hiatal hernia is found accidentally when someone is getting like a chest x-ray or a CT scan done for something else, and then during the course of that they may find a hiatal hernia as well. Many people have small hiatal hernias, right? But it's typically asymptomatic, meaning they're not having any symptoms. And of course, if you're not having any symptoms, then it's hard for you to know that you have it. For one, you're not going to do any explorative or diagnostic testing because you're not having any symptoms, right? So a lot of people have it, but they don't have symptoms. And we'll talk more about this, especially when it comes to diet, because that also plays a role in why someone may have a hiatal hernia or small hiatal hernia. Then we'll also look at what are some of the different categories of food items that can help to reduce the likelihood of someone getting a hiatal hernia when it's relating to food. If you have any of the symptoms that we've gone over so far, but you've not yet been diagnosed with having a hiatal hernia, and you've been told that you have reflux, don't just take it for it being reflux, right? Ask some more probing questions. Be an advocate for yourself and don't feel shy about it. It's your body and it's you who is feeling the discomfort that you're having, and you know your body best. So don't be shy about, speaking up and asking more probing questions so that things can be further evaluated. And if you feel like you've checked all these boxes, then again, don't be shy about asking potentially if an endoscopy would be recommended to rule out that you don't have a hiatal hernia as well. What are some of the questions that you can ask your providers? Well, you can ask your primary care provider if the symptoms you're having could be related to a hiatal hernia, right? You can also ask for a referral to see a gastroenterologist to rule out the possibility of this being related to that. And if you were to see a gastroenterologist and they do diagnose you with having a hiatal hernia, you're going to want to find out if you have a sliding hernia or a paraesophageal hernia. And I would like to think that if you were to have a paraesophageal hernia, that they would highlight that for you so you can be aware of that and potentially share with you other measures or different interventions that would be better able to take care of that, right? So you want to ask that question up front. What kind of hernia is it? You want to ask, what lifestyle changes, what dietary changes can I implement into my regimen before starting medications? And then, of course, like I mentioned, if your primary care provider, if you're talking with your primary care provider, you can always ask to be referred to a gastroenterologist if you feel that you've checked all these boxes and that potentially it could be relating to your symptoms could be relating to hiatal hernia, especially if you've done a lot of workups and everything has come back clear, but you still continue to have symptoms. So this is what I want to end on. Hiatal hernia is manageable with the right lifestyle modification, dietary changes, sleep positioning, like all these are factors that play a part in it, and all these are well able to manage the situation at hand depending on the extent of your situation, right? But also medication sometimes may be what will help, right? But you want to be doing everything else that you can be doing to help better manage the situation also. Again, the symptoms that your body is expressing, whether it is chest pain, heart palpitation, reflux, pain in your shoulder blade, like all these are symptoms that your body is giving you as signal to say, hey, something is out of alignment, something is not right, you need to course correct. right? Something needs to change in order for you to have a better result, right? So don't take this as your body malfunctioning for no reason. This is your body giving you signals so that you can make the necessary adjustments to have a fully functioning system, or a more efficiently functioning system, that is. In upcoming episodes, we're going to be talking about diet, specific foods to avoid, foods that help, meal timing, portion sizes, and all this is in episode 3 and 4. Then in episode 5, we'll be exploring exercise, and I've already shared the exercise I did on this channel. I shared it, what exercise it was that helped me to bring my hiatal hernia down. Then we'll also explore medications, PPIs, H2 blockers, antacids, what they do, long-term risk, and my perspective as a nurse on those. Then I'll also be sharing in later episodes the 30-day protocol, the full structured approach that I use to maintain my life, maintain a life free from having symptoms or issues relating to hiatal hernia and other digestive dysfunctions. I've built an entire series around this, so click the playlist and you'll find that in the description. Share this with someone who's having issues relating to digestive health, as well as if they've been having any of the symptoms that I mentioned that has not yet been settled as to why they're having those symptoms and they're still searching for answers. All right, thank you for watching. Stay blessed, and I'll see you in the next one.